first flight of the orbiter Discovery, and the shuttle has cleared the tower.
Hello, beautiful people of the Health or High Water podcast. I'm one of your hosts, Trip, with...
Hello, everybody. How are you doing today? Brett here.
Hey, guys, we got a really interesting conversation. We know a lot of you guys have been dealing with pain in your lives, with shoulder pain, back pain. We're going to dive into how we can help you guys out with that, as well as give you guys some insights on how we fix these problems. I've had shoulder issues a long time. I got tackled into a filing cabinet when I was 17 from someone in the MS-13. This is a real story, man.
No, go ahead, keep going. That's all right. I didn't mean to laugh.
I was walking into social studies, and this guy, Roman, he was, aggressive dude. He tackled me to a filing cabinet.
Hopefully he got suspended.
No, no one never found out.
Roman, if you're listening to this, shame on you.
Dick. But yeah, and I had issues with that forever. I went to PT, I went to doctors, and the only thing that really helped me out was, actually like going to the gym and doing things myself. Mm-hmm. Do you see a lot of people out there trying to fix some pain themselves because healthcare professionals are not able to do so?
Let me give a tiny quick shout out. Hey, for the new listeners, if you're just joining us, number one, I'll get right back into that. Just want to say thank you so much. Hope you're having a wonderful day. We appreciate, we love you. We're glad to talk fitness. We're grateful to be in this position to discuss this. So thank you so much for joining our journey here on Health or High Water. Sorry, just got to give a quick shout out to
that's my fault. I missed.
No, you're good. To the faithful. Your question, getting right back into it, was back pain and.
So it's more about people right now that are being, I feel like they're almost like left alone because healthcare professionals cannot get them to where they need to be, whether that's surgery, PT. There seems to they seem to be missing things like muscle imbalances and sedentary lifestyles, and they're not taking the entire problem, at foot. Like, so when you have clients and stuff like that, do you see a lot of that? Like people that are just left alone?
It's all disconnected. If you're in severe traumatic pain, you go to the doctor. What does the doctor say? They run an MRI. They look at an X-ray. All right, maybe you go to a chiropractor, right? Because you don't get answers from a doctor. All right, chiropractor says your L4, your L5 is compressed. All right, let me readjust it. But once you readjust it, okay, the pain comes back after a few weeks. Okay, I'm going to go to a personal trainer. All right, I'm getting stronger, but now I'm re-aggravating my pain. So right now, it's all disconnected on, hey, how do I, on an educational perspective of, hey, what is this pain and how do I actually progressively start to put my body in positions that allow my body to help heal itself? That's really the disconnect.
And where does painkillers fit in with all this too, about ignoring pain and actually getting to the base of it?
Yeah. So like opioids, we could have something like narcotic related, like opioids, which should only be used in like acute situations if it's absolutely necessary. They're incredibly addictive and they cause horrendous like life problems. So opioids and narcotics should only be used in very specific instances. Like I said, acute trauma.
It's like terminal stuff too, right?
Yeah. Terminal stuff, quality of life stuff. And then you move down the list to like ibuprofen and Tylenol and some of these other ones, which are, mildly pain relieving. But then again, that's not a long-term solution, right? Your liver's got to process that. You need more and more so that's really not the answer long-term. Is painkillers are really just a bridge the gap situation.
Oh, 100%. And, a lot of us, like my family included, are not well versed in how to use things like even ibuprofen. Shit gave me an ulcer.
Correct.
I took it way too long, and I should have, took the pain straight on. So getting into that, let's go ahead and getting into like clients, how they react with things. A lot of commonalities you see. Mm-hmm. One of the things I really want to start talking on, and before we get into how you fix it and whatnot, is like posture, muscle imbalance, and how you attack that for your clients.
Mm-hmm. Most of what I see is learning the wrong mechanics in the first place, not learning how to hinge correctly. That's why if you look at my videos, the first thing I teach is the hinge. I'd say 85% of the injuries I see are because people aren't hinging efficiently in the first place. We can get in a little bit more into depth on hinging as far as what that is, but essentially as you bend over, it's a coordination of your posterior and anterior tilt of your hips. If you come in here to train at Ascend here, that's the first thing we're going to teach you is, that's what hinging feels like. The other 15 to 20, 25% is maybe either it's a repetitive stress injury or it's a acute injury, like it just happened, you fell, something like that. And not every back injury or shoulder injury is going to be able to heal 100%, right? It doesn't mean you're going to address somebody and they're going to heal 100%. They're going to be perfect. But we have these right protocols to improve it and start to address these issues.
Oh, I absolutely love it. Something else I want to bring up too is I want you to kind of go over sedentary lifestyle and how that affects injuries, getting them worse, as well as exacerbating other things, right?
Yeah, so that's a great question. So sedentary lifestyles. As soon as you said it, I was like, I'm gonna hit this one.
Oh, no.
No, that's a fantastic question. You don't have a degree in pronunciation. That's fine.
I don't.
I knew what you meant.
It's just communications.
No, that's a fantastic question. So sedentary lifestyles are it's happening more and more. We have more desk jobs. More people than ever are actually working, we'll call it white collar jobs. They're sitting down, right? You have more in finance sector, software developers, business managers are sitting down. And they say, there's an old saying that it has some truth to it, is sitting is the new smoking, right? So your muscles are activated throughout the day when you're walking, and that's their job. When they get dehydrated, they dysfunction. When we sit down, we have about 20 minutes of posture, okay? About 15 to 20 minutes where our body is comfortable sitting down. It's active. And then what happens is our brain sends a signal to our body to relax our muscles. Well, what happens when we relax our muscles but we don't relax our mind? Okay, so we can relax our body, but we have to relax our mind at the same time. So if we're sitting and we're working, our mind is not relaxed, but our body's relaxed. That's disalignment. That causes issues posturally, because then we're putting the pressure on what? Our joints, ligaments, and tendons. Our muscles are supposed to be responsible for our position, but the second we relax, and like I said, about 17 to 20 minutes is as long as we have before our muscles turn off and we start to absorb some of the gravity weight on our joints, tendons, and ligaments.
That's a really great answer.
Mm-hmm.
Dang.
Mm-hmm.
So some I see a ton in clients too, and this is kind of bridging off what you're saying, is neck and trap issues that pull on the shoulder joint because they're and again, if you guys are sitting in your car on your phone, whatever, like, you know, take a second, breathe, and think about your posture right now, and think about how it is, because you know, we all of us do have these white collar jobs, and we're sitting on our computer and what I'm seeing so much. I'm thinking like even like 95% of people I see have tight traps that are pulling on shoulders. What are some things that viewers can do to kind of help out with their posture when they're sitting down for too long? Do they make a schedule? What are some things you recommend?
Yeah, traps are definitely tight. Traps' role is to bring the shoulders up to cover the neck. It's a protective mechanism. So they lift objects up, and also they're a way to engage our arms when we're carrying something. So that's their purpose. They can also, if you're cold, think about if you're freezing, you bring your shoulders up to keep you warm. It covers your neck. It brings your center of gravity in closer. So that's the role of it. So when we're stressed, what do we do with our posture? We curl up into a ball. So that's, now that we know why we do that, and also with injuries, if our shoulders are injured, we bring our body closer to a center of gravity. It just in a percentage purpose, it reduces our risk of injury. So if we know that, and we know that our traps, what was the second part to that question? Was the trap's purpose, you see it a lot, the injuries in it, and then...
What happens is, what I see is those muscles, the traps or whatnot, are pulling on other muscles, causing imbalances and injuries in other places, because what happens is people only look at the shoulder as the injury.
Yeah.
When the traps are the reason that they're hurt to begin with, because they're being pulled for compensation reasons.
Yeah.
Right? So the question is, like, what can we do, whether it's working out, to try to make sure that we're I didn't say the question right.
It was right.
How we could be more aware of this.
Yes. A simple answer to a complex question is develop a great lifting and stretching protocol daily. That's really the simple answer. Find a protocol. It has to be lifting. If you're not lifting, you're missing out. You need to be lifting. If you're just doing yoga, is great. I love it. Pilates, fantastic. In 2023, you need to be lifting weights. You can still do it with injuries. If you're in a wheelchair, you can lift. If you're even if you don't have, if you're missing an arm, like there's always a way that you can find a way to lift. It's so healthy for your hormones, your body. So find a way to lift in the right manner.
No, I love it, man. So where do other things like sleep, stress, how did these affect your shoulder and back injuries as someone already has one? Because you said, we're protecting a little bit, we're making sure that it's not getting hurt any worse, but in actuality, we're making it worse because we're tensing up and making things bad.
Yeah, sleep and stress are like brother and sister. And when I look at somebody and I meet them and I get to talk with them during sessions, I get an idea of where they're at stress level immediately. Number one, there's a lot of telltale signs. Just being a people person, I get an idea of somebody's stress level. But really, to answer your question, in order to really heal ourselves and to put our bodies into a state of healing, is we need to lower our cortisol. We need to have better thought practices. We need to think more positively. Those things will affect our sleep. If we're worriers, if we're stressors, if we carry the weight and the burden of the world's problems on our shoulders, which is pretty common, we're going to have sleeping problems. We're going to be worried and anxious about, what do I got to get done tomorrow? There are people who are great at this, who don't worry and are relaxed and take their time. They sleep great. And so the big thing is just finding ways to sleep better through stress reduction, through purposeful thought practice, and through positive reinforcement from trainers, from our family, from our entire surrounding environments.
Oh, I absolutely love it. All right, let's get into your job when you have someone coming in, they're hurt. What is your procedures with this? I'm sure that you're also trying to instill confidence in these people too, because they're been out of the game for a little while probably. They've been hurt. They don't feel like their old selves. So what's your processes and procedures when someone does come in with a back and or shoulder injury? I can't speak today.
Today?
Today, Junior.
Today, Junior. So most of the time when people come in, they've been to somebody else before, right?
Right.
They've been to a chiropractor, they've been to a physio, they've been to a doc. They've seen people, and they lose confidence every time they see somebody and don't see the improvement. So they're coming in a lot of times going, all right, what are we doing here? They're not sure. So I have to be very accurate with how I articulate and explain the recovery protocol, and then my assessment process of what I think is going on with them. I think if I can do a really good job of saying, hey, here's what the problem is, and I don't need to get into the minutia and be too esoteric and be like, oh, your L4 is compressed and on the left side. I don't need to get that deep. I can say, hey, listen, there's a restriction in your lower back. It's probably some disc damage, okay? It's causing nerve damage. I don't typically need to get so in-depth, but as long as I do a good job of identifying and articulating that in my diagnostic process, and then I can provide an accurate treatment protocol, that tends to get people to go, oh, okay, all right, that makes sense. Like, all right, I feel comfortable. And then as you start to see results over the first week, the second week, then you go, oh, we're making progress. Okay. And that's kind of my thought process, getting a client in the door, making them feel comfortable, and then getting them out of pain, number one.
So that's amazing, man. So you've coined the term biomechanical assessment, right?
I don't know if I coined it, but we use it now.
It's coined now.
Yeah. I've heard the term many times before, but.
Well, can you explain a little bit about your biomechanical assessment and how it fits into our optimum genome blueprint nexus?
Yes, definitely. So the biomechanical assessment is essentially, number one, how is somebody moving? How are their hips functioning? Are they hinging correctly? How's their posture? How's their knee alignment? Is their knee moving inward to compensate for a weak glute muscle? Are they able to achieve all their range of motion? How's their ankle flexibility? Is their spine in pain? Like even their running or walking or jogging, how are they landing? Are they landing on their heel, their toe? How's their balance? Is their balance shifting to their left or their right? Which side is stronger, their left, their right? Is their right shoulder hanging lower than their left? Are they a right? So there's a ton, as I kind of ramble off, you can see there's a ton of things we're looking for in this biomechanical assessment. These all play a role in how we're moving. No one's going to move perfectly. That doesn't exist. We all have individual bodies, genetics and epigenetics, right? But the goal is to identify these movement patterns, figure out where our strengths are and where our weaknesses are, and then develop protocols to improve our weaknesses and get us moving more efficiently so that the muscle tissue can grow in those areas to do its job. And then that becomes part of the biomechanical assessment to incorporate into the genetics and the precision supplementation and all that.
Well, that kind of goes back to what we were talking about before is like what we do here is we want to make sure that your entire life is healthy, not just one portion, and they're all synergetic to injuries and injuries that they're lingering, you know, because like you said, that certain things like sleep or stress can affect the injuries you have and make them worse.
Totally, definitely, yeah. It's a huge. This is the biomechanics is the way you move, but really what we're trying to do is just get people to live better, healthier lives, eating breakfast, managing their stress and their time better, managing getting to the gym on time and getting their sessions in. And so it's an overall program.
And I think it's one of the most important parts of our program to begin with, because how are you supposed to do a workout? How are you supposed to sleep? How are you supposed to work on posture if you don't know those things? I feel like it's like the blood work of the body. Or for the skeletal and joint system. So let's say someone is listening.
Check. Am I on? Check. Yeah, you were. Oh, okay. Usually I see two different wave streams. No, we're good.
That was a test for me.
Chickadee 1, 2, 3, 4, 5.
Chicka beastie boys.
Sorry about that. Just making sure we're all good.
No, I love it, man. So let's say someone is listening right now. They have shoulder and or back injuries. What do you recommend them doing if they don't have Ascend performance training right near them?
Listen to this podcast.
Listen to this podcast and tell everybody.
Find somebody who knows. Honestly, I would get them to have them find their best health professional, somebody who's specializes in it, and yeah.
Well, also, guys, if some of the videos that Bret has put up is some of the best stuff I've actually seen on social media in a while, because it's very simple. You can apply it right away, and it'll help with some of these situations. If you guys want to go check that out, it's on. If you go to YouTube and search for Ascend Performance Training, and all the videos and most of our podcasts are up there as well, so you guys can almost learn as you're listening to the episode too, if you guys wanted to. But yeah, man, that's an important part that I don't think other people are doing. And you see someone going into a personal trainer nowadays, and they just get right to work, and they're missing all this qualitative information that is just sitting out there lingering. And you're right, there's more frustration happening. People, and then they end up coming seeing people like you and me because of this frustration.
And I've seen people too. For instance, I'll put this out there. I've seen people too with, like, let's say a severe shoulder injury. Let's say they have frozen shoulder from many years ago. It could be, and I'm thinking of people who I've worked with.
Right.
15 years ago, they say, "Hey, listen, my shoulder's bad. It's not. I've seen every doctor. It's not going to improve." And there are times where we'll just not improve the shoulder, and we'll find movements that don't involve the shoulder, and they lift great. They lift hard, intense, but we just don't pick movements that will exacerbate that injury. So there's times, there's a lot of gray area in the assessment of this, because let's be honest, not everybody wants to just come in and start to rebuild and do these small movements. So really it comes down to working together with people and figuring out what their goals are and what they really want from their programs. And then through that, we find ways to progress some sort of a program to get them healthy.
So one of the biggest things here is working together as a team with your professional, whether that's you, a physio, or another doctor, working as a team to get through these. Yeah.
So I should always ask for feedback and say, hey, we did some hip stuff today. Did you like this, or did you prefer? That's sort of should be my rhetoric as I'm asking for feedback, because this is a co-op. I want to do movements that people enjoy doing and that are producing the results we want to. There's lots of different ways to work out, and the main thing is to enjoy yourself, right? We want to enjoy ourselves having a great lift so that we can release those dopamine serotonin, so that we can have all those feel-good accomplishment chemicals.
Well, I love it. What are some extracurricular stuff like ice baths or foam rolling? Is there anything that you would recommend to anyone with an injury like that?
So ice baths for sure, 100%. I don't care what science you've come out with. I don't care if you're a doctor, a PhD. I don't care if you're an astrophysicist. Cold therapy is one of the best modalities you can use for many reasons. You can go into the skin health of it, or you can just take a logical, common sense perspective. What happens when we step into cold water? Our muscles shake and our body tries to heat itself up. Well, there's a lot of things that happen in our bodily processes as our body shakes and tries to heat itself up. So not only is it great for our skin, but it literally runs the gamut of all the health benefits that come from our body being thrust into that adversity. There's some benefits from sauna too that I see. I'm not as much of like a crazy fan as much as I am of cold therapy. I think cold therapy is way better than hot. Although I'm not against saunas and heat therapy. I think there's benefit to it. And then I'm trying to think what else. Anything else I would like totally recommend. Those are like the big things. Honestly, I'm kind of a naturalistic. Like keep it, as natural as possible.
How do you feel about massage guns?
Whew, man. So massage guns are crazy because what it does, it's a miracle in this sense. It can turn muscles off and on as we want them. So let's say someone's in pain. They have a disc compression, L3, L4, whatever it is. And for 3 weeks at a time, those muscles have been active, constantly active, protecting that injury. You take a gun, a Theragun, to that muscle and it turns it off. Now that can be good and bad.
Right.
So it can be good and bad because that muscle is protecting it. So the good part is it allows us to release those muscles, get the person out of pain, stop nerve firing. But then it allows us to do soft tissue work, right? And then we can get in there, we can start to push some of that stagnant, stale fluid through their spine and their erectors, spinal erectors. And then it may come back, right? The muscle may retense up. So there has to be an additional protocol to the Theragun. But as a tool in our arsenal as trainers and physical therapists, it's an amazing tool. Everybody should have one.
Oh, I agree. I've had that same gun since 2016, and if it's not in my bag, I'm not going to the gym.
Yeah. It has to be, but it's mindful too. It's not just, I'm sore, I'm just going to take my gun to my sore muscles. Like for me, that's kind of like, okay, like I'm sore. Like there's a thought process behind what you're doing with the gun. So even if somebody has it at home and they're like, I could do this myself. It's like, well, if you don't know what you're doing or like what you're looking for, you could take the gun and you may feel better, but you have to intellectualize the process of what you're doing, turning off the muscles, re-engaging the correct muscles, and articulate it through that process.
I agree. I think the best similarity you can kind of, for you guys listening out there, is we had an episode on Intro to Posture, which is doing really well. Thank you guys for out there listening to it. We talk about the mind-to-muscle connection using the foam roller. Mm-hmm. It's not just a dough kneader. Like I see a lot of people with the Theragun, and they're hitting the majority of the muscle, the thick part of the muscle, like the middle of your chest. And when in actuality, it's your insertion points that are causing it to be tight to begin with. So hitting your underneath your armpit for your chest, hitting your trap, hitting your abs, all those around it are what's keeping it tight. And that's for me. That's how I've used the Theragun and seen so much success in it. Mm-hmm. Is because I'm using it to loosen the muscles up right before my workout. Mm-hmm. Now everything's loose, and I tighten the right things up as I'm going. Mm-hmm. Right. So again, guys, all these are tools that can be used wrong.
Yeah, so there's one thing that is, I heard, who was it? It's owner of a physical therapist, and I knew this before, but he kind of brought it to my attention. I'm like, oh yeah, and he's doing a study, right? I can't name off who it was. I forget. It was one of my friends on LinkedIn, and he shared a study with me. And the study was about releasing rib cage muscles, but not just muscles, like dormant muscle tissue that had been damaged, right? So muscle's supposed to squeeze and flex and have a function, but around injury and other things and stress, sometimes muscle dysfunctions, and it stays like that. But his study was about releasing these muscles in and near the rib cage so that the diaphragm had more room to expand, right? So so let's say we do yoga and we're trying to expand our diaphragm and we're trying to grab fuller, deeper breaths for more optimal oxygenation through our bloodstream. If we don't have a rib cage that has its full expansion capacity, we're suboptimal. So his study actually produced mood improvements, which is crazy. Mood improvements and happiness factor directly correlated to improvements in rib cage muscle functioning, like serratus, obliques, transverse, all those muscles. It was kind of a wild, and I totally have experienced that. I haven't created a study yet, but I was like, wow, that's a fantastic study.
Well, again, I'm not sure exactly, but my educated guess would be the amount of oxygen you're not getting and the quality of oxygen you're getting.
100%.
And there's a direct correlation with any sort of nutrients, whether it's oxygen, vitamin D, simple things that can correlate to things like we had on Dr. Dorner that could cause lupus. Everything's synergetic with what we're doing, and that shows you why. I think that study's amazing, and I truly believe it, man. Like having your whole body loose, I know there's benefits to that. But I know we're kind of winding down on this episode. Guys, thank you guys so much for listening. This episode 31, we can't believe we're already here. We're about to break 1,000. Make sure you guys are liking, subscribing, and sharing to everyone. Thank you, Bret, so much for the amazing information you came on this podcast with. Make sure you guys are going and go checking out Ascend Performance Training on YouTube, looking at Bret's videos. They're amazing. And he uses a broomstick.
It's a expensive broomstick. Yeah, for sure. A lot of what we're focused on now is what I've realized is not pain management, because that's a terrible term. Getting people out of pain and getting them moving better and functioning more properly. So using a proper assessment and just honestly giving hope to people. A lot of people have lost their hope that they're going to recover or find a way to improve things. And acceptance is good in a certain sense, going, okay, I'm injured. What can I do now? But honestly, I've seen miraculous improvements, and the body has this innate ability to heal itself. It really can heal and do miraculous things that doctors will be like, what? That doesn't scientifically make sense. I've physically seen it before. And so if you give it the ability to do that through proper nutrients and moving correctly while coupling that with your breathing patterns and your breath work, and then you're improving the capacity for your lungs to expand, you're going to improve. You're going to heal injuries. You're going to reduce pain. You're going to have muscles regenerate themselves. Through that regeneration, you're going to release spinal pressure. Even your shoulders, may gain more flexibility. So these are the things that fascinate me. It's kind of why I do what I do, and I want to spread the word, and I want people to have that hope and know they can recover.
Well, that's why I love working with you, man. We're about changing people's lives, not about selling something, which seems to be the industry standard right now. Well, guys, again, thank you guys so much. We couldn't be here without you all. If you guys want to learn more, go to www.ascendperformancetraining.com. If you guys are in the area, come out for a free workout. If not, make sure you guys are going to the blog and reading the blog, because it's amazing. Health Profiling, our book, is now on Kindle and Amazon. Colorado Valley Labs now has 4 new supplements. We have vitamin capsules, we have vegan protein powder, we have CoQ10, and we also have hair, skin, and nail supplements now for vitamin B.
Is there BCAAs and protein back in stock?
Tomorrow. Be back in tomorrow.
Shout out real quick to that. You can get precision nutrition, so no longer random and, hey, take this protein. Like, we will figure out what you exactly need, and we have it for you.
Yeah, we'll do blood work, genetic tests, whatever we got to do to give you the right qualitative information for you. Again, guys, thank you guys so much for watching Health or High Water.
Take care. Have a good day.